And I will be letting people in 3, 2, 1.
Okay, well, good morning, everyone. Almost afternoon. Thank you so much for joining us. I am Natalie Littlefield, the Vice President of Strategy at the Borderplex Alliance. And we're so happy to have you here for our very first Binational Technology Forum. So this is an initiative at the Borderplex Alliance, and it's a co-initiative of the Binational Technology Forum and the Supplier Association. So if you're not familiar with the Borderplex Alliance is a 501c3 nonprofit organization. It focuses on economic development with a focus on business attraction, policy advocacy, and strategy. And it's that third part that I oversee as part of our strategic initiative. And this forum directly relates to our strategic plan in that it is for the purpose of encouraging the responsible adoption of technology by businesses for the benefit of businesses, workers, and in this case, from the Telehealth Forum for our patients. So why telehealth and why is this important to the Borderplex Alliance and being highlighted in this forum? So the forum will have 4 different focuses throughout the year of 2021. The first being telehealth, the next being advanced manufacturing, then fintech, and then aerospace and defense. And so that's programmed for the year. Each one of those focuses, it has a strategic strategic purpose. Telehealth, of course, has been not only an area where we can help companies grow and access more patients and help patients get the healthcare that they need and deserve. But also we've seen in the pandemic how important telehealth services has been, not to just people in rural areas and Indian reservations, although those are areas that are certainly in need of telehealth services, but also just your everyday person who might have needed or needs to access their doctor, but does not want to be exposed to the COVID-19. So telehealth is of special importance to many people across the community. And it certainly has an economic development purpose as well. So this is an opportunity today to take a different approach to how we typically talk about technology, and the whole idea of starting a brand new technology forum. And there's a couple out there already, but this one, what makes this one different is that we plan to talk about what technology, emerging and advanced technology exists, and then we want to talk about its impact and effects on business workers, and again, patients in this case. So that's the purpose of the forum and the difference with this one and other forums. And so before I kind of kick this off and talk about the event forum, I did want to mention that there is an exciting new partnership that has been developed with Workforce Solutions. We are working with Workforce Solutions to provide funding for training, for equipment, software, marketing, for any company or organization that would like to provide telehealth services. So we have a couple of people from Workforce with us, and so they'll be on hand later on to talk a little bit more about that program and what we're doing together. But for the time being, that's just something to keep in mind as you listen today to all of the great, wonderful speakers that we have, and how that might relate to what you're doing. So without further ado, today's event, the format for today's event is that since we're taking a slightly different approach, we're going to take a slightly different approach to the format as well. So I'm going to briefly introduce our speakers, but then I'm going to allow them 5 minutes each to talk about themselves and how what they do in relation to telehealth. And so to give you a little bit of background for for the following discussion that we'll have regarding the technology's impact on what they're doing. And then we'll open up at the end for about 15 minutes or so for questions and answers from you all. So you'll have an opportunity to ask your questions of all of these different speakers. And of course, if you have, at the end, if you have questions about the following telehealth training program that I mentioned, we can discuss that as well. So I would like to I'm so excited to introduce to you today the people that we have with us. First is Dr. Ogechika Alozie. He is the medical director with Sunset ID Care. He is formerly with Del Sol Hospital and has worked at several different hospitals. But you may know him if you're in El Paso. You may know him as being one of the leaders in El Paso's pandemic response. So, Dr. Alozie, thank you for all of that you've done for us, and we're so excited to have you here today.
Thank you for having me. I'm excited too. Hi, Catherine. I see you waving.
You're a rock star, and thank you.
He's a rock star, right? And I'm so excited.
We could not have done with Dr. Alozie. Thank you, sir.
Appreciate it. Thank you.
We also have Diana Olivar, Chief Revenue Officer with Boost Human. And Boost Human is a local startup company using cutting edge technology to do new things. And so we're going to get to hear about some of the things that they're doing and some of the things that are possible with the technology that they're working with. And finally, we have Tim Washburn. He is the Chief Clinical Officer with Electronic Caregiver, and Albert Parra, Corporate Director of Human Resources with Electronic Caregiver. And so if you're not familiar with Electronic Caregiver, they are an amazing telehealth services company. And they are leading the way in telehealth, both in this region and beyond. So it is a real honor to introduce them. And I will now turn the floor over to Tim and Albert to give us a little bit of context as to what technology we're talking about and what Electronic Caregiver does. So we are kind of going to go in the order of looking at the technology and then looking at the experience with the technology. So I will pass it to you, Albert and Tim.
Well, thanks, Natalie. It's an honor to be here. I want to thank you for bringing us to this forum and allowing us to talk about Electronic Caregiver. As Natalie said, my name is Albert Parra. I'm the Corporate Director for Human Resources here at Electronic Caregiver, and my role is really utilizing and capturing the talent in the area to really make our products and services come to life. And Tim and I work closely together, and that's a very short what I do. I'm going to let Tim say what he does.
Sure. So thanks for having us. I'm a registered nurse by trade. I'm technically the chief clinical officer. The only thing that matters is I'm a nurse. I've been a nurse for almost 30 years, and just really glad to be here today. So thanks for listening. With that, can you guys see my screen? Are you able to see? Okay, perfect. All right, so I'm not a big PowerPoint guy, so I'm going to kind of skate through this so I can get to the meat of what's important to a nurse from their perspective. Electronic Caregiver has been around since 2009. We really pride ourselves in technology, but most importantly, technology that supports the work of folks like Dr. Alozie and others in the clinical space. We call it connected care, the concept of technology that helps people, not technology for the sake of technology, which I'm sure we've all seen plenty of. So of course, our mission is really to take technology, translate that into effective workflows for physicians. We do that by making sure we have a good platform, and then we also do that by working very closely with the clinicians to make sure that whatever use case, whatever workflow, whatever setting, it actually adds value both to the provider and to the patient. Our goal, of course, is to help those we can help. So we all kind of know the problems, but there's some numbers that might scare you a little bit. They certainly scare me. We have lots of folks with chronic illness. Our big focus has always been on chronic illness, and I'll be showing you a few products that we kind of aim toward that. When 40% of the US population has chronic illness, and we don't have enough doctors and nurses in the middle of a pandemic, you kind of see what we saw with the headlines. So we'll talk a little bit about what we did in Las Cruces, and it sounds like Dr. Alozie's got something to share with the work he might have done in El Paso as well. So for us, as I think Natalie mentioned, the pandemic really didn't change our trajectory, but it certainly moved up the timeline. If y'all get a chance, you can look up COVID to Home in Las Cruces, New Mexico. We actually partnered with the state, the county, 2 hospitals, a couple of doctors' practices, 2 residency programs, and a university to really take our technology to monitor folks at home so they could be discharged from the hospital but still be safe and not feel like they went home with nothing. And it really helped us. We never ran out of beds. We didn't run out of ICU beds at either hospital, and that was a request that came from the county. So again, real high level, I'm not a techie. I like tech if it works, and I like that it helps, but I don't get fancy on it. We have a few products, Premier, which is mostly personal emergency response, but also the ability to hit a button and talk to an on-demand telehealth service. ProHealth, which is the device we use a lot of, thousands of times a day, to really take advantage and support remote patient monitoring. Protector Initiative is one of our digital health products. So if you want to pre-screen staff or visitors, the ability to kind of ask some of those questions related to COVID or really any disease process. And then of course, Addison on the far right there, she's our virtual 3D caregiver that is going to be on focus group testing within the next 30 days and will be launched in the next, probably early next year. If you got to look at those products, we don't look at technology as the end game. We actually look at technology as just a different user interface applied to a different cohort or group of patients who might benefit. And by the way, it isn't limited to just patients. Certainly on the private sector, employee benefits, employee health, senior living facilities, any of this technology really is aimed at improving the health and wellness, depending on how you want to use it for any cohort. Everybody asks us, well, what did COVID do for you? And we always say nothing different than we weren't already doing. It just made people see things that we've been telling them they need to look at for a long time. And when we think of connected care, taking technology and putting it within the workflow of a provider to actually help, what we have now is technology. We can actually do clinical outreach. We can support any of the remotely delivered telehealth type processes, CCM, RPM, with technology, without. We really have built a company that takes the technology as one component, not the most important component. Most important component of connected care is care coordination and getting the care team all involved in the care of the patient. We really, in some ways, kind of want to hide the technology behind the technology and make it as easy to use as possible. That's how you get engagement. So when we think of our platform, we have our back end, and then we have different modules that represent different functionality, vital signs, or different equipment, the Premier versus ProHealth versus Protector Initiative. And then what we layer on top of that is the ability to bring in other components in the fairly near future, the ability to do an Alexa skill type moment where we can let folks come in and write different programs, take advantage of our platform and leverage our technology. We fully recognize we don't have all the answers. Providers have most of the answers, and we just want to make sure our technology fits in that growing scope of care that is supported in the telehealth space. So this is Addison. I'll give you a little teaser on Addison. She's not out yet. She'll be coming out. She'll have a far field camera, or far field mics, a RealSense camera. She'll be able to do things like monitor somebody's gait passively and recognize when they're at increased risk for falling, and then leverage some of the automatic alerting threshold setting that we have on our products now with that. So for example, Dr. Alozie, we would have the ability, if you happen to do rehab, which it doesn't sound like that's your specialty, but if it was, you could actually get a sense of how well is the patient doing that rehab. Are they doing it right? And the machine itself, through edge computing, can kind of show the patient or the participant, here's what it should look like. There's an awful lot more I could go on. I know we're pressed for time. Our technology is a lot more in depth than what I'm talking about. But at the end of the day, it's all about fitting into the workflow for us. So if you want to talk more about your use case, give me a holler.
Yeah, and the technology with ADDISON is the interactivity with patient and just the whole idea of connected care. You know, ADDISON is a voice responded, voice recognition piece of technology. So it will really make the user feel more comfortable and be more willing to engage with ADDISON, which I think is important when you talk about healthcare, because if people are not going to use the technology, then there's really no point in having it.
Yep, it's just an expensive doorstop. We don't sell expensive doorstops here. And this is just a sense of our partners. You know, we've been around with a lot of folks, but Intel, AWS, Google, all the names on there. We have a lot of support in the big technology companies, because every time someone uses our stuff, the meter for their stuff kind of runs. So that's one of the things we really pride ourselves in. We look for vendor partners and clinical partners. We're not your average sell technology and leave. That's not our thing at all. And again, we can go over that. A couple of examples of does it work? Because it's great we have tech, but if it doesn't work, who cares? So a couple of things. We've done a study in Mississippi with our Premier on readmissions. You take patients, it was 986 patients with our Premier out of 5,103 overall discharges. And we actually saw a 47% reduction in readmission rate for those that had our tech versus those that didn't. If you can engage quickly and easily and patients see value, they feel better, they're less afraid, and they tend to engage. And if you don't do that, they don't engage. And then of course, COVID home, as I mentioned, you guys can Google that, but in the city of Las Cruces, just before Thanksgiving till about 2 weeks ago, when we actually wrapped up the program, because we met our goal, we served 252 people. We have estimated, very conservative, so this is a low number, avoiding over $2 million in hospital costs in 100 days, using the ProHealth, working with clinicians. So does our technology work? When you do it right, yes. Does it save money? When you do it right and involve the care team, yes. And that's the kind of stuff we'd love to talk with whoever wants to hear from us about. So bottom line, the future is now. We have a small organization you guys might have heard of. The World Health Organization will be visiting us in May. And we're going to be starting a project that I can't discuss the details of, but it's a big project for the German-speaking European population. So big plans, lots to do, lots of ways to do it. And let me know if you have any questions. Thank you.
All right, thank you so much, Tim. That was fascinating, and don't worry, you'll have a chance to dive into a couple of these things in a bit. But for now, I'd like to pass this over to Diana Olivar with Boost Human to talk about what they're doing at Boost Human.
And Diana, I think you are on mute.
Diana, you're on mute, yes.
Okay, let me share my screen. Is that working?
Yes, we can see it. You're
Okay.
good to go.
Thank you. Thank you, Natalie. Thanks for that introduction. And I'm excited to be here as well. And I loved hearing about electronic healthcare, and the fact that they're here in this region makes me super excited. And Albert, don't worry, I'm not a techie either. So I'm going to try and explain what we do in very broad concepts. So thank you, everyone. My name is Diana Olivar. Boost Human, we're a software development and consulting firm that's headquartered here in El Paso. We are a startup. We've been around since 2017. I came on board in 2019. So these are kind of new concepts for me as well, but it's a very exciting time. I'm going to go quickly through this. So I'll stay on task here and keep my time. So what we do is we harness VR and AR technology. It's also known as mixed reality technology. And we develop custom solutions for our clients. We're in the manufacturing space, higher education, healthcare, and government. So basically, we are trying to help people learn faster, deeper, and retain that knowledge longer by taking traditional modalities of learning and delivering them into a more immersive experience. Aha, okay. So speaking of technology, my technology is going to be a little different here. Okay, so here's our team. We have a team of software engineers that have master's or doctoral degrees in computer science, software engineering, and over 7 years of academic industry experience with similar systems. So I was just appointed as the managing partner and CEO of this company. We're pretty agile and nimble. So I'm actually now leading the day-to-day activities for the company. And my background is actually in economics, sales, and business development, working in competitive industries in Chicago over 20 years, although I am a native El Pasoan. So I returned back home 8 years ago. And really my mission is to invest in our region and our local talent. So I invest in local business, and along with Boost Human, we're trying to do our small part to elevate wages, our economy, and innovation in this region, and primarily to keep our local talent here. So how do we boost human capabilities? Learn, troubleshoot, connect. This is a natural workflow. Before joining the workforce, we learn. When we're out in the field, we face problems, we troubleshoot, and we fix. And along the way, we keep learning, right? So now we're going to be learning from here on out. So
I just got off the phone with John Law.
Along the way, we are reskilling and upskilling our skills and other skills. So when we become the experts, we can connect and transfer our knowledge to others and teach others out in the field. So our suite of products enhances these workflows, and we do it through technology. So that is why our name is Boost Human. So why immersive learning or learning by doing? This is not a novel concept, but think about this. We all know there's a reason why pilots are trained in simulators. It's safer, it's repeatable, and it's cheaper. So on-the-job training is one of the best ways to learn. So how about doing this on-the-job virtual training before we actually go on the job? The outcomes are learning is faster, deeper, and knowledge is retained longer. So you all take a minute to think about how you learn. Most have probably seen this pyramid. Some people learn best by reading, others are auditory, others like me pull up a YouTube video when I need to figure out how to do a recipe or do some kind of DIY thing. There's a quote that goes something like this: I hear and I forget, I see and I remember, but when I do, I understand. So I pulled up a use case in a Harvard Business Review, and there was a subset of about 300 employees that were tested on their conceptual understanding of their company core values, half of whom did it in VR and half did it in a traditional PowerPoint. And 48% of the trainees who did VR learned all 6 concepts, compared to only 3% who used traditional methods. So this truly is an impactful way to learn. All right, so these are just examples. There's a ton of them out there about this technology. I cherry picked these just to make my point. So a medical student is now, they can practice training with VR technology. On the right-hand side, imagine these kiddos. They're watching a zebra. They have this virtual reality, and they're watching the zebra just sipping water right by a stream, and it's right by their side, and they actually feel transported. They feel like they're there, like they've just experienced this. Not only are they engaged in the learning, but they look like they're having a lot of fun. This is an actual case study. We did 7 of them with NMSU. They were having constraints finding places to send the RDNs, the registered dietitian nutritionists, to complete their clinical hours in order to graduate from the program. So the full capacity of their program can have 12 interns. However, their accreditation limits them to a maximum of 6 due to the lack of availability of placements. Las Cruces is a small place. With our interactive hologram solution, now more interns can train, graduate, and join the workforce immediately. And they actually did this pre-COVID. So they were well ahead of the game. And last year they said, thank God we had this tool. So I'm going to show you a quick 1-minute video. I hope I have time here, but I'm going to set it up real quickly because it's going to go fast. There's going to be 4 videos that you're going to see. And basically, this is a sampler of our capabilities. So let me go ahead and run this for you because they say a picture is worth 1,000 words. So this is anatomy AR. So someone with their phone scanned the room and they were able to superimpose this human anatomy. This is one of the examples for NMSU. This was through voice recognition. The person has a HoloLens on and they're able to interact and diagnose a patient. In this case, it was diabetes. Okay, on the bottom of your screen, you see someone wearing a HoloLens. They're controlling that robot arm with voice and hand gestures. They can walk around it, they can assemble it and disassemble it. They can really learn the components of whatever it is they need to learn. The sky's the limit here with whatever you could train on. And this last one is in virtual reality. So we did a simulation of a physical steering wheel. We helped a company out in Chihuahua with their steering wheels to help their employees learn how to find those defects quicker. Okay, so that last one, these are just the concepts to keep it simple for everyone to understand. Virtual reality was that last video we just saw. You put on a headset and you completely immerse yourself into another world. Versus the middle part, which is augmented reality. In this case, you see the physical world and you have an overlay of information to guide you, to take you step by step. Think of Google Maps, and now with cars that have the headsets on the top, you can actually see the information there as you need it. And then the last one, mixed reality. Basically, to keep it simple, the concept, we're combining virtual reality and augmented reality in one. And this last one is just some of our partners that we are working with and clients. And so to recap here, hopefully I was okay on my time.
We're at about time, Diana.
Okay, so I'll leave it there.
Okay, I think that video was completely worth the extra time though, because every time I see that video, it just boggles my mind what is possible with technology, and just seeing it in the context of the medical industry. I think you can see all the possibilities of it. And yes, it can be applied in many different industries, but it's very exciting when you look at specific examples of how it can be applied. So thank you so much for that, Diana. Fascinating stuff. And congratulations on your promotion. I know it's recent. So excellent. Looking forward to seeing what you do with the company moving ahead. So
thank you.
All right. Last but not least, Dr. Alozie, the floor is yours.
All right. Thank you very much. Can everybody hear me?
Yes, we can hear you.
Perfect. I just want to make sure you could hear me. I was like, uh-oh. You know how that goes sometimes. It's always when the person that's supposed to be a technology person gets on that everything goes completely. So I will share my screen, and I'm going to try to keep to 5 minutes. Hold me accountable if I am not. And so my name is Ogechika Alozie. Hi, I've been here for 11 years. Wow, it doesn't feel like 11 years. One of those crazy things where all of a sudden you wake up and you've been here for more than a year and a decade passes and your kids are, one's about to go to college, one's about to go to middle school. But I will say that I feel as if I've been a part of the community and I have this journey. I think we all have a journey. I'm just going to sort of talk about my journey and then why it may be relevant to a conversation that all of the stakeholders here have. As many of you know, when I first came, came to Texas Tech, University Health Sciences Center of El Paso, started off an HIV clinic. And then somewhere along the line, I became their chief medical informatics officer. And that is important for a number of reasons, but I'm going to dive into something really quick.
No longer what it used to be. Convenience is winning. And we as consumers, both from a healthcare standpoint and every other standpoint, need to do the things that we do more efficiently, more quickly, more integrated. And whether it's taxi, travel, entertainment, restaurants, consumer products, and healthcare, I ask you today, if you were to go outside and call a cab, you wouldn't go, taxi, what'd you do? Uber, exactly. You go online, you don't call a travel agent, you go to Kayak or whatever it may be. Entertainment, whether it's StubHub, whether it's Live Nation, those are all the tools that we use today to do things that just 4 to 5 years ago were very, very different. Once upon a time, you had to know the maitre d'. Get a corner table, get the best bottle of wine, now you go on Open Table. And not only do you go on Open Table, you leave a review so that the restaurant knows whether their service was up to par and how to improve it the next time. Consumer products. Amazon will get you anything in essentially 24 to 48 hours. It's now the largest retailer in America. Used to be Walmart, now it's Amazon. In some cities in this country, a drone will get it to you in under 2 hours. And of course, in healthcare, you all know that it's exactly.
And I think that's the point. And I kind of love this evolution that we've had, because that was a conversation we were having back in 2016. Somewhere along the line, I sort of transitioned out of Texas Tech, went to Del Sol. I was their chief medical officer for about 18 months. And it's interesting, when I started there, nobody knew that COVID was going to come. And so one of the things that was going to be one of my top projects was telehealth and how to integrate it into an acute care setting, since I'd already started doing that at Texas Tech and I was doing it in my private clinic as well. Then COVID happened, right? And what's interesting about it, COVID sort of triggered a host of things for me. One was that I really missed patients. I missed giving patient care. I missed wanting to run my clinic. And so I've come back as a medical director of Sunset ID Care. And just as importantly was this.
Right? I see it every day when patients come to us and say, I don't have access to your patient portal. I really want to see it because I need to see a doctor in California, in Texas, in Minnesota, across the world. That patient portal allows them to transfer that information.
And so when we were having this conversation back in 2016, I clearly remember a host of organizations, not just Texas Tech, the Hospitals of Providence, Las Palmas del Sol, across the spectrum in our region. Other regions were a little bit ahead of us, saying, hey, we can't do this. This doesn't make sense. We're not going to put in all the money and infrastructure because we're never going to use it. And then COVID-19 came. And we clearly see the changes that have happened since then across the world and also in our local dynamic. I think sort of prove that point. This is my clinic, and this is sort of what we had been doing in terms of appointments per year in our HIV side. And you can see we already had an increase year over year, 18 to 19, but COVID pushed it up. Most organizations that were healthcare from an ambulatory standpoint had a reduction in total appointments. So we're proud of that. On the right-hand side, you can then see what we had, because we were already using telehealth, so you can see how it went. It started slowly, and then by August, September into December, we were at almost a 2 to 3 to 1 ratio in terms of using telehealth versus in-person health. And so really proud of that. Last one, and then I'll stop talking.
To people that are more comfortable in healthcare. A lot of times people say, no, yeah, this can't happen. What are you talking about, man? We don't have the money. We don't have the resources, the political will. You may be right. I may be right. I think one of the things that you have to understand, though, is that all of us in this process have to have a little bit of humility. I ask you to turn to your neighbor right now and tell them what the color of the yield sign in your neighborhood is. I'll give you 3 seconds to do it. Sir? Yeah. Yellow, right? Most people say yellow. And yet, the yield sign in the United States of America has not been yellow since 1971. That change is older than me.
And I think that sort of summarizes the point. As leaders and people that are running technology, adapting to technology, struggling through technology, we all have to have that humility to understand that we don't know what we don't know, but also that humility to take on change and accept change. I'm excited to talk to all the groups that are here, answer some questions. 2020 was the year of the masks. I believe 2021 is the year of the vaccines. If you haven't gotten it, get it. I think that technology is going to help us get through this. And I'm done talking. Thank you very much.
Dr. Alozie, that was amazing. And I had no idea you'd given a TED Talk. So I'm thrilled to see it. And it's fascinating. And I'll start asking you some questions now. I really want to, I know that we've kind of had this progression with everyone to talk about, let's talk about grounding us in the technology. When we're talking about telehealth technology, what do we really mean? So we kind of have a sense of that now. And now we come to you, and you've talked about the importance of it. But maybe you can elaborate for us, what does it mean to have the capability to provide telehealth as a professional working in the medical field? You're taking care of patients. What is it? Kind of ground us, and what are we talking about on a day-to-day? What are you trying to achieve? What do you need to achieve with telehealth technology? And what has it been like for you in practice?
So a couple of things. I think it's different things to different people, right? I'm a vanilla, maybe a butter pecan guy. You may be chocolate. Albert and his crew may be tutti frutti. And so everybody has a little different flavor to what telemedicine means to them. I think at the basic sort of foundational level of what the patient wants an experience that's no different than any other experience they have in their life. So whether it's with banking or with Amazon or with anything that they do when they pick up their smartphone and it's encryption enabled, multiple lock bit, everything face or fingerprint enabled, they want it to be simple. The second sort of level to that is at the core, it is, do you have internet, right? And you know what, if you had asked me some years ago, I was actually really naive and flippant about the internet piece where everybody has internet. Well, we realized during COVID, especially with the amount of kids that weren't able to go to school, just how bad the broadband is across the country and specifically in Texas. It's one of the bills that one of the committees I chair, the TMA's Task Force on Healthcare Technology, is really pushing hard for us to make an investment in Texas around broadband. Without internet, none of this works. I think then the sort of next level is the things that electronic caregiver is doing, Boost is doing, is then creating those systems, right? Creating the systems, just the hard work on their end, but from the physician side and the patient side, it should not be a lot of hard work. One thing that helped from a physician side is that when COVID came, immediately one of the great things that Texas did is they created payment parity. So a televisit got paid as an in-person visit at the same level. And so you saw an immediate jump in the physicians and clinicians that were using telehealth and telehealth services. I think there's a lot of conversation about what telehealth is going to be able to do, whether it's a primary care visit, a specialty visit, post-surgical, pre-surgical, all that. That's going to be legislation. I try not to worry about that too much. For our purposes, it's really making the process comfortable and making sure that people like Boost and Electronic Caregiver and a host of others have the resources locally. When I say locally, in our sort of tri-city area, Juarez included, so that they can continue to grow. And I think that really has to be sort of a policy and finance thing that we think about in our region specifically.
Mm-hmm. That's important to remember, that the legislation has to keep up with the speed of technology advancement. Now we have to keep having conversations like this to understand what it is that you need to best serve your patients, and what is possible, and try to make sure that the policy keeps up with the needs of the technology. So give us a little bit of an example, perhaps, of you talked about, you want it to be, the technology needs to be as easy as possible, and you want to make sure that the patient has an experience that is just like any other experience. Could you maybe kind of describe to us, and perhaps it could be maybe at the hospital, but it also could, or Texas Tech, but it could be at Sunset ID Care. a situation where you could see yourself, where you have actually used the technology. What was easy about it? What was challenging about it?
Well, I mean, I'll give you a clear example. So I have my iPhone, just opened it, swipe, second swipe, just swiped in Athena. So I have an app, Athena One. I use Athena as an EMR. It's going to facially recognize me. So I'm now logged into my EMR, right? And I immediately know how many patients I have and who to see, right? And I'll give you a clear example. I'm in Curacao right now. I'm doing some COVID work for a DoD contractor, but I had a patient that went to UMC. They were in the emergency room. And so they texted me on this. I got a little ding like, oh, you're in the ER. So I quickly went to their chart, looked at their chart, and I did a FaceTime visit within the app. It's all encrypted within the app. I talked to them. The ER doctor was beside them, talked to them, told them, hey, this is their history. This is what's going on. You'll be fine. This doctor will take care of you. These are their labs that I'm looking at that you just did 2 months ago. And then we hung up. I sent it to billing, hit a few keys, it went to my biller, got billed, done. I got paid for the visit. I never had to leave my phone, never had to leave a native app. They were on their phone. It came through as a FaceTime call for them. The doctor got their information. And then I went back into Athena, sent the doctor a fax also from the app, 3 clicks, and I was done. And that was it. Under 5 minutes, patient was happy, physician was happy, I was happy, I got paid, right?
Yes.
That's how the technology has to work. Anybody else that tells you it should work, oh, we have this workflow, it should do 5 minutes. No. Am I getting paid? Is the patient happy? Is the other side happy, the clinician, whoever it may be? And is it seamless that I don't have to go out of my workflow? I'm on my iMac or I have my iPhone, I have a tablet to my left. That's how technology is supposed to work. And I really get frustrated with vendors that come and try to pitch us on, well, we have this other thing that we've created. No, don't give me the other thing. This thing right here, I just ordered a pair of Nikes for my kid, right? I have an Amazon subscription that sends me stuff. I mean, don't make me come outside of that workflow to buy a box and a server. And I mean, that's so 1992. And so I think that is a clear example of how technology works properly, smoothly, and in an integrated manner to help all pieces of the puzzle get to where they need to be.
Yeah, that streamlined, simplified, elegant user experience is what we've all come to expect now. And so it's got to be that way, right? Well, let me kind of punt this back over to electronic caregiver, because you all are leading the way in some, it's not an app, not necessarily used on the app. It could be used different ways, but kind of tell us from your perspective, what electronic caregiver, for a little bit deeper. I know you had to rush through, but just hearing what Dr. Alozie is saying with the ease of care for the doctor, for the patient, and maybe begin by telling us about your technology and how it addresses these needs and demands.
Sure. So I couldn't agree more, Dr. Alozie. When I first got to electronic caregiver, I'll never forget it. They said, here's our patient dashboard, and all the doctors have to do is sign in here. And I'm like, okay, everybody, we're done with that. So whereas Dr. Alozie is talking about interfacing, I think, on the inpatient side or ER to Dr. Alozie, our big focus is on the in-the-home patient experience. So for Dr. Alozie, a simple app that connects to Athena that he's used to, great. But obviously, especially on the elderly side, who may not be able to see that app or read that screen, or heaven forbid, I love it. All you have to do, patient, is go on your phone, download this app, make sure it's up to date, connect the Bluetooth O2 sat probe to it, and when it crashes, call your doctor. And Dr. Alozie goes, hey, everybody, hold on a minute. Why are they calling me for tech support? So an electronic caregiver, we kind of think about it like a coin. If Dr. Alozie's story is one side of a coin, the really critically important other side of the coin, and obviously the government believes in this because they've expanded CCM and RPM. They recognize that we don't have enough doctors and nurses, and we can't get them into the offices today anyway because of the pandemic. We know that appropriate care coordination with monitoring equipment that's easy to use. So for the patient, our Pro Health has 3 buttons, just 3. One is a button, it's cell enabled, no internet. They don't want to get on their phone to talk to a doctor sometimes, especially with certain cohorts. Some do, no question. but a lot can't. Give a glaucoma patient a 4-inch screen, see how well you do. We already know the outcome. They die over time or end up in the emergency room or the urgent care. So one button, hit it, you're immediately talking to the box to a member of your care team. Well, that's the other component. I'm sure Dr. Alozie would really appreciate having 1,000 patients call him anytime, day or night. At the same time, he's getting notified of 1,000 normal blood pressure readings. You excited, Dr. Alozie? You probably can't wait, right? So leveraging technology that does 3 things: easy use for the patient, single button access. That you can set alerts and thresholds based on the patient needs. Tim Washburn may not have hypertension. So if he's over 160 systolic, Dr. Alozie may want to know. But Al's very, very tense and anxious, and that's true. He's a very anxious guy. If he's over 120, I warned him he was going to get picked on. If he's over 120, maybe Dr. Alozie does want to know. And maybe Dolores, if she's over 200 because she has a history of a stroke, we know she's going to run high. Bottom line, whatever that threshold needs to be, let's control that. Let's set that. Let's give Dr. Alozie real-time actionable data that actually adds value. And then the third thing is, since we don't have enough nurses and doctors, what we really ought to be doing is leveraging existing payment sources, which Medicare has, RPM and CCM, for example. Leverage that so that we have this basic entire army of trained folks who will outreach to the client, will manage those alerts 24/7, will act based on Dr. Alozie's protocol, which might be a little different than Dr. Washburn's protocol. Leverage that so that for the physician experience, real-time actionable data based on what they need to know. For the patient, I hit a button, I'm talking to my care team. It really is that simple. Now, it's not that easy to do, but from a workflow perspective, that's what they expect, and that's what Dr. Alozie expects, and that's what our patients expect. You make it complex, they don't use it. So that's really been our core focus. How do we connect everything extra clinical so that it works for Dr. Alozie? And it's not added work, it's effective work, and lets him know what he needs to know when he needs to know it. That's our big focus.
Mm-hmm. You mentioned this a couple of times, different ways that you have these medically underserved communities. We consider in this region, we kind of consider that is who we are. But then there are other, on the outlying areas and rural areas, Indian reservations, absolutely medically underserved areas. And this, your technology can serve them. And I think it's worth kind of delving into that just a little bit. Who can use this? Who are your users? Is it, we talked about, okay, a single doctor here at a big hospital, or is it, who is it? Like kind of flesh that out a little bit for us.
It really is anybody who has a need to remotely monitor someone. Now, could it be Dr. Alozie? Dr. Alozie, I'd love to talk about if there's a protocol you're using on HIV patients, maybe at a certain stage. That's the kind of thing we build our technology around. So I'm going to say something out loud that my boss doesn't like me saying, but since we're recorded, he'll just have to deal with it. Not everybody requires technology. The government should not be spending money on a $5 app that doesn't get used and doesn't add value. The government should be spending money on those things that work. Dr. Alozie, we should be adding resources to that cohort of patients who need it. Everybody else we should leave alone. Don't waste money and don't waste our time, and certainly don't waste Dr. Alozie's time. So really anybody works. Employers who want an employee wellness program. If you've got a population of CHF patients that work for you and you're not managing that aggressively in a way that keeps them safe and healthy, your attendance rate's going to be down, your retraining rate's going to be up. And you know what? Your employees are not going to get benefits and sort of the sense of caring that they need. And that's, as an employer and an employment shortage, here it comes. We're all hearing about the economy booming back. You better take care of everybody. So it's everybody, Natalie. It's really any cohort group of folks who have a need for telemonitoring. We can tailor that and should tailor that. To Dr. Alozie's point, don't give them what they don't need. Give them what they need, make it easy. We can do that anywhere, anytime.
So it
We
could
are.
be it could be it could be a nursing home, like you mentioned. It could be an employer. It could be an individual as well, correct? So if
Absolutely.
I could sign myself up, or I could sign
Sure
my mom
could.
or my grandmother, or some, if I wanted to, I could. So it's
Absolutely.
basically anyone, whether I oversee others at a school, at a daycare, or I want to do something for myself. I'm a potential customer and user of your technology.
Yep. Tailor the technology to the person who needs it in a way they will. Overly simplistic sounding, I know, but it's what we do every day. We're good at it. We've learned a lot of ways not to do it, and a lot of ways to do it. You know, you learn and grow as you go.
Yeah, that's amazing, and so much to be done, and so many ways to use your technology. So if we're looking at, I want to kind of turn the conversation just a little bit and talk about maybe a small medical firm, and this might apply to a variety of other types of businesses, but let's talk about a small medical firm that is interested in digital transformation. It's kind of a buzz phrase right now, digital transformation. So it's having some kind of capacity, not necessarily electronic caregiver, but some kind of capacity to reach their patients. This is potentially an area where Boost Human could come in and do a little bit of training for the staff on how to reach their patients using some basic technology. It's also an opportunity for Diana, as you mentioned, a major institution such as NMSU, to integrate the type of technology you're working with to train others in the medical field. Can you kind of dive into what that might look like from an employer point of view, and then from a major educational institution point of view, and any other who might utilize your services for training purposes?
Sure. No, thank you. Anybody who wants to accelerate knowledge transfer, again, there's traditional modalities, they work, and it's not replacing that. But if it can augment that and help get people, students, workers trained quicker, have them retain that knowledge faster, then we will work with those organizations and figure out what the need is, right? So we custom develop these tools. In the case of our virtual patients, the holograms, where I see a really good fit right now is in patient care, right? So how do we teach those soft skills, and how do we do it on demand? And now that we have to be remote, how can we get those tools to more people, more students, and have more throughput quicker? So that's kind of where I see our technology can be it could be scalable as well. If we look at a universal problem and we can say, okay, how can we help develop something that a lot of institutions can share and use? I think that could be a very scalable, a very beneficial solution.
What's interesting about what you're doing, Diana, is that it is customizable, and it can be used for a small company who wants to do something really basic, or it could be used for a large institution trying to do something for many different students, or just trying to lead the way on using VR, AR, mixed reality technology. So I wanted to just tell the audience we're coming up on our Q&A portion. So please let me know. I'm not sure if people have already put in some questions, but please do think about some questions. Please just think about some questions you might have for our panelists or for our upcoming training program. But I wanted to ensure that I gave Dr. Alozie a chance to also talk about patients' interaction with the technology. So we've talked a lot about we don't have a patient with us today, but we did talk a lot about the opportunity to improve the patient experience. Dr. Alozie, have you maybe received any feedback from your patients as to what they've liked to see, or from a quality of care perspective? Are there certain things that can be improved upon, given that it is not an in-person doctor-patient experience, that it's remote? There must be, with a limited amount, this is a brand new technology, new field, emerging industry. So there's always going to be room to improve the quality of the patient experience. What can you tell us about the patient experience and how it's that interaction can be improved?
Yeah, I think at different levels, and again, I will talk about the sort of ambulatory experience, right, where majority of healthcare sort of exists. I think that one of the things that you learn really quickly, right, is that you can script your surroundings. A lot of organizations have a certain background in the back, or they have a virtual background. And I mean, I'll tell you straight up, because of the amount of melanin that I have in my skin, a lot of those virtual backgrounds kind of suck, right? And I disappear into them because I'm not pasty white, and that's okay, right? So you just have to figure out where you're going to do it. I think also, and I tell colleagues this, don't get so stuck up on protocol that if you have to call a patient and do a visit from your car, that you do the visit from your car, right? You will be surprised how comfortable it will make patients that you're not in this stiff, sterile environment, right? They'll engage with you a lot more. But I think more than anything else is eye contact, right? And just having a conversation like you would if they came into your clinic. And so if your style is gruff, it actually translates worse by a televisit than it would in person. Because in person, they can see all of your body. When your face is the only thing they're looking at, if you have any facial tics or dynamics, or you're always having an angry face, patients get put off by that. And I think there's some research to show that. I think the other thing too is if you're in a sort of clinical workspace, and this happens, and I'm sure the ECG guys do it, and other people in hospitals and care homes, have a process so that the person's not on hold for 30 minutes trying to get through the quote unquote waiting room, right? I mean, if you have to wait as long for a televisit as you do as driving to the place and filling out paperwork, you failed ab initio, right? Your process is a mess. And so somebody should do a pre-call. Somebody should do a reminder. And then we have a text messaging system that sends them a reminder the day before and 30 minutes before. And then if they have problems, then we'll walk them through it, right? And I think the key thing, sort of like Albert said, not everybody needs technology, right? So my under 25s are probably 70% of my telehealth business. My over 60s, not as much. If they want to and they're engaged, we'll help them figure it out. But if not, then we'll bring them in person. And we were doing that throughout the pandemic, right? Technology isn't the same for everybody. And so I kind of think that as we sort of evolve from the pandemic and more people are vaccinated and we try to figure out what's next, I think we're going to live in a hybrid world where some people are going to want not to come. Some people are going to want to come. Some people will need to come because you need to lay eyes on them or get blood work. And so the healthcare system is going to need to be dynamic and flexible and have multiple different flavors, as I said before, to the tools that help them work through this. And I think that's the patient side. As long as you give patients things that work for them, they're flexible and they're on their schedule, patients will come and they'll utilize the technology.
I want to pick up on something you said about when someone sees their doctor and their expression and their tone, all of that can make a difference to the patient experience. I want to mention, allow electronic caregiver to you guys to talk about ADDISON, because I know this is a new feature for you and it addresses some of this. And I know you're all very excited. It looks like an amazing technology.
Yeah, I couldn't agree more. So we have a lot of experience on it's how you present the message, the intonation, the cadence, that sense of connection. So whether you're talking about the technology or the interaction with people, either with or without video, ultimately, how you say something often matters more than what you say. It's an old nurse talking, been a lot of years at the bedside. With ADDISON, we'll be using cameras to not only look at, did you take a pill, but sort of look at that countenance of the patient. So do you have a patient who's saying, yes, I'm fine, but has, physical features that very clearly show they're distraught? And if you do that, what do you do with that information? So Addison is really going to be focused on taking everything we do now in terms of ease of use and applying that to that voice integrated touch screen, far field mics, real sense camera, looking at you. And our founder always says, everybody buys an Alexa, and why didn't we just do an Alexa skill for our work? Well, here's the reason: hard to fall in love with the speaker grill. Really, really hard. Like, I don't feel he's got two speakers and I couldn't talk. I feel like Hal, right, on that movie, like I'm talking to a nothing. So Addison has environmental mirroring. So if it's snowing outside your house, it snows outside her house. Oh, by the way, she's in a house. You can sort of tell her what room to be in the house. So the visualization, the ability to connect and engage, the ability to see when something is wrong versus just hearing what the patient wants to share with you that might be wrong. All of that stuff is that next level experience. And ultimately, it's got to make sense. It's got to work. The patient's got to feel not like they're being watched by Big Brother. So we don't have something that looks like us. There's that Disney Pixar sort of methodology. Yeah. It's kind of cute. It's effective, but not creepy. You ignore her, she's going to start listening to music and kind of ignore you until you call her name, and then she's going to interact with you. So that whole visual experience is the next level, and we intend to add that to a lot of the things Dr. Alozie talked about. The ability to do telehealth will be through her, and Addison will almost be Dr. Alozie, kind of this virtual assistant who you'll be able to interact with, and the information she's collected, she'll be able to give you, so that when you do that telehealth visit, you'll have access to information you wouldn't have otherwise. Maybe a change in cadence or a change in gait, that kind of thing. So really kind of connecting loop, leveraging technology to give Dr. Alozie meaningful information in a very non-obtrusive, non-creepy, engaging way. That's what people want. They want to feel, especially if they're elderly and alone, there's somebody they can talk to, but not a snitch. Somebody who's engaged and can get me help when I need it, but not watching me every second like Big Brother.
Yeah, I think part of that, Addison, too, we talk a lot here about, the engagement of it all. She couldn't be something that was too cartoony that people couldn't take serious, and she couldn't be something too real that people would be intimidated by, because again, we have to spark that engagement. So the research and the time to take to make her a visual that people would be very comfortable engaging with was very important to the technology side of it.
Mm-hmm. Thank you. And that's important from the user point of view. If you're trying to use electronic caregiver, you want to feel comfortable. You're interacting with a piece of technology. It's not human, but you want to feel comfortable with it to share your life with. Then all of that, I guess it does make a difference. It will make a difference to those users. There's the other side of things where Dr. Alozie might not be willing to hang in the towel just yet and wants to get better at providing those services without the scrunched up face. No, I'm kidding. But there's an opportunity through Boost Human to kind of address some of this sensitivity. We'll call it sensitivity training for lack of better phrase. But Diana, maybe you can tell us a little bit about what you all can do through Boost Human to address this particular issue that patients have, and this need that they have to interact with doctors that are pleasant and interact with them appropriately and warmly, and have that bedside manner.
Right. Well, no, I just wanted to interject a little bit here before I jump into your question. There's no replacing that human interaction. I don't think, anywhere, right? What we're trying to do is just how can we give people access to a better experience, right? So I think we're all in agreement there. From the patient side, I will say having an 84-year-old mom and having to deal with all of her doctor visits, it's great to have the option to maybe not have to take her physically to every doctor appointment if she can see a doctor, you know, if there's an option to do it through telehealth, to do it remotely. So I do love that aspect of it. Now, my mom is not tech savvy. She's 84. So a lot of times I'm the one that has to set up the little video for her or do whatever. I will say I would rather do that and let her have access to the healthcare she needs than go and maybe drive her, expose myself or her to, you know, to COVID and all of this. So during this time of the pandemic, I thought these tools, absolutely, I was very happy that my mom could still get the care that she needed and keep her safe. So I think there's a time and a place and you know, a way for all of this to work in tandem and to enhance our lives, not to make us tools and technology and things like that. So like Dr. Alozie said, you know, his patients on remote are probably the younger digital natives versus the older people. But I think once the older folks kind of get wind that, hey, there's a way that you can still be connected and be safe and do this, and it's more time efficient, then that's great. I was recently at a doctor visit where they handed her an iPad, and this is for an endodontist, and they handed her an iPad to input her stuff, all her information. Had I not been with her, I'm sure the poor ladies behind the desk would have had to sit there and help her do this. So those are the kinds of things where I see these technologies like what electronic caregiver and Boost Human is talking about, where maybe you have a interactive experience, right? Where that person can ask you all of the things that you would normally type in and make it easier for that person, make the experience better. Maybe have it be, obviously in, you know, in our region, be in Spanish. So they have the option, you know, to press the red button or press the green button and make it interactive. It's something that they can just communicate with. So by the time they get to Dr. Alozie, all of that stuff has already been done. And Dr. Alozie can just, you know, spend that critical time with that patient, and all that other stuff has already been done.
That's an interesting perspective, Diana, because a lot of people do care for their elderly patient. They're the ones kind of helping them navigate this, and if they don't have that, then you've got some barriers. But then there are the absolute benefits to someone who is older as well. You save the time, you don't have to travel and put all of that effort in. That could be very hard on an elderly person. But before we run out of time, I did want you to kind of mention to the group what you told me about Boost Human's capability to provide training for that customer experience, or for, in this case, the patient experience.
Yeah, so those soft skills, I call them power skills, right? Empathy, patient care in this case. It could be any customer service. You know, the realm is limitless. It could be a de-escalation. It could be, you know, anybody who needs to practice interacting with a person, and they can do this with the use of these tools, and they can do it on demand at their own pace and really get that experience because they're going through that muscle memory that they've actually experienced this situation. And if you can put somebody in the shoes of the patient who maybe has chronic pain, right? And you can understand their side of what they're going through, I think that builds a tremendous amount of empathy, which is something that when we can allow people to feel that, they can come to what they're doing from a very different perspective. And it's a higher learning of engaging with those people.
Yeah, and it's a fascinating technology to think about how using this for teaching someone's staff or just someone who wants to get better at the patient experience. But I know that a lot of people are now honing in on how to improve that patient experience, and so this is, you know, new tools to be able to do that. It's just something to keep in mind. If you have any questions right now, we'll start taking some questions. I had one come in already. But if you would like, you can put it in the chat, or let me know that you have a question. I believe you can hit a reaction and you give me a thumbs up. That might be a way to do it. So I'll start with our first question from the group. There's a question about cybersecurity with regard to ADDISON. Since cybersecurity is such a big issue and it's important to protect private information and access people's medical history, you know, is cybersecurity something that's built into ADDISON, and how does that work? And how do you ensure that the patient's private information is kept confidential?
Yeah, so of course we use all the standard industry stuff, and Dr. Alozie, I'm sure, could add to this, but encryption both at rest and in transit, encryption on both ends, all of the things. You know, our big partner, we use Amazon Web Services. So I'll say out loud, the US government gets hacked. So I don't want people to have this false sense of you can avoid all hacks all the time, no matter what. And anybody who tells you that's true is lying to you. That's not the truth. That being said, you follow the industry standards, you pay very close attention. For example, we actually monitor our system. We have our own NOC. It's a security system. It's the IT guys call it that. But basically, we monitor all transactions, and we have set up to monitor for failure of transmission or any spike or change in activity that could be representative of some sort of something weird, and then we go after that. So we follow all of those standards. Dr. Alozie mentioned the patient portal that's on his phone. You know, we hear a lot about the news. It matters. You got to be careful. But I think that, you know, the news likes to trumpet the things that go wrong. It doesn't mean they're not important, but security is always evolving, and we leverage the biggest players in the business to make sure we're following the standards as they evolve. And that's about as good as you're going to get. Dr. Alozie, I don't know if you have a different thought on that.
No, I mean, I think, like you said, I mean, you always have to work with a vendor or a partner, I like to call them, that's focused on security, right?
Mm-hmm.
So if you're out there and you're dealing with a partner and they're not talking about security first, and they're not bringing to you the HIPAA compliance and talking about their security infrastructure and how they're tethering or what, whether they're using Amazon or Azure, whoever it is, that's probably not the partner you want to use, because you do want your stuff to be as secure as possible. Now, again, it isn't possible to be 100% secure because people get hacked and broken into all the time. And so, but you have to have a partner that at least focuses and understands security.
Okay, thank you for that. I have another question here about there appears to be several businesses that are set up. They can be set up to provide telehealth processes and protocols and systems. And what they're asking, what can be done in this space for smaller businesses on a tight budget? And I think this might be a great time to make sure our partners are on the line here. But a great time to discuss a little bit more about some of the funding and training programs that are available. I know Dolores is with us from Workforce. I think the others may have jumped off, Dolores. So
yeah, they needed to jump off for a little bit. So we just wanted to reiterate, as far as like small businesses, we've partnered with TWC. So we do have some training for grants available for the skills training. And as far as hardware, we do have some funding through our digital services grant right now. So if there's those small businesses that are interested in this, we definitely do have the funding. I think she put in the chat our emails. If you just want to get a hold of somebody at Workforce Borderplex Solutions, we'd be more than happy to walk you through whatever grant funding we have available to assist you in getting this training or getting this equipment so that, you know, you can go ahead and be part of the telehealth.
So yeah, and just a little to add to that, Dolores is with Workforce Solutions Borderplex, and she's of course, they're the ones with some funding available that's I think a little bit more flexible for both El Paso and southern New Mexico in terms of the equipment, software, marketing, anything that you might need. And I think the training dollars are limited to Far West Texas. However, I think according to Alma and Maria Soto from Workforce, if anyone on this call knows of someone, regardless of the location, they will do whatever they can to make the funding work if possible. So if you do have, if you have you're personally interested in having some help, some training, some help paying for software, for anything that you might need to set up telehealth services within your company or within your memberships companies, please reach out to us. You can reach out to me. I'll put my contact information up at the end, and you can, I'll connect you to the right people over at Workforce so they can give you all the information. They'll walk you through, as Dolores said, they'll walk you step by step through connecting you with the right training providers and putting together a program for you and your staff. So that is how we're going to go about that. And are there any questions? Any other questions from the group before we close?
Natalie, can I add a little bit to the question on the 25 businesses asking for help?
Yes, absolutely.
We get this, I get this question all the time. I get asked things like, well, I want to start small, so you don't want to work with me, right? Well, of course I want to work with you. We don't have a Medicare population only, so we probably can't work with you. Well, of course I can work with you. The concept is there are a lot more options in telehealth, which to me consists of telemonitoring, which is really kind of our expertise, and telemedicine, which of course is Dr. Alozie's piece. But the reality is there is no one size solution that fits any business or circumstance. Very naive if you think it's that simple. But the reality is there's lots of folks, companies like ours, and I think we're the best, but of course I would say that, but there are a lot of folks that want to have that conversation. ECG has everything from standalone digital health services to standalone clinical outreach services to standalone health coaching, employee wellness type services, to 3 different kinds of hardware for technology. So can we help 25 businesses? Absolutely. What if they're different? Okay, no problem, get on the call. Because what we're going to find is what you need is different per business and even within the business. Like Dr. Alozie said, look, the heart wants what it wants. Consumers want what they want. They don't want to be talked down to or told what they must have. So the short answer is, of course, they can get help. Of course, there's opportunities. Of course, it's scalable. First step, have a conversation. Work together and understand the need, and then develop the solutions that fit the need. It's not about sales first. It's about what do you need first.
Yeah, that's an excellent point. Let's go ahead, Dr. Alozie.
No, I was just saying absolutely. And I think when Ms. Ramos-Davidson had put her message in the chat, that's probably kind of summarized what I said, right? There's no one size fits all, but it can absolutely be done. You just have to have the conversation, right? You have to have that first conversation and then scope it out from there. And I think that's important. And so I think you have multiple people on this call that can help anybody that's interested in taking that journey, because it is a journey. And so I think we're all amenable and available.
Okay, yeah, that's an important thought, and like Tim said too, one size doesn't fit all, and it takes a little bit consulting. In the context of Workforce Solutions, they have a digital transformation team. They were available to at least join this call and hear more solutions that broaden the solutions that they're able to offer. But I think that's the first step. But obviously something to keep in mind, and they'll probably dive into that when they reach out to you for potential services, Tim and Albert. So, well, everyone, thank you so much. I'm about to share my screen so that you have my contact information. In case you just want to add all right, great. Add me as the host, and I'm going to throw up my screen, and please let me know if you can see
Yes, it's up.
my contact info. Okay, great. So if anyone else has an interest in participating in the training program, or an interest in getting some funding for training or equipment licensing software, marketing, please reach out to me and I'll connect you with the right people. So that's my email address. But I just want to close. I'll stop sharing for a second and say thank you all so much for being with us, and to our speakers, our wonderful speakers. Thank you so much for your time. We value you and appreciate all of your insight and sharing of experience. So thank you for being with us, everyone. All right. Have a great afternoon, everyone. Take care.
Thank you, everybody. Have a good one. I appreciate it.
Bye. Thank you.
Bye.
Bye-bye.